Hello, everyone. Thank you for joining this webinar on such short notice. My name is Suzanne, and I'm the Communications Coordinator of the World Duchenne Organization. And today we're having this webinar to facilitate the questions to clinicians on the current coronavirus outbreak and how this might affect the Duchenne and Becker muscular dystrophy community. So I will be doing this together with Elizabeth Rome, who is the chair of the WDO, and we will also be here to moderate the questions and discussions at the end of this webinar. So more about that in a minute. First, I'd like to explain how you can join this discussion because you will be automatically muted upon joining. So your keyboard is your voice. So would you like to ask a question or give almost like a broad overview of what is happening in your country at the moment? You can do this via the chat option when you click in the top right corner at the speak bubble or in the middle if you're on the app. And after the webinar has ended, we will collect all the questions that we haven't answered during this one and do it in a follow-up webinar. So this webinar will be recorded and be made available for you for sharing after, together with a report that you can disseminate with your families and clinicians as well. So for that, I'd like to give the microphone to Elizabeth, who can open this webinar and do the introduction.
Oh, I'm unmuted. Welcome everybody to this webinar, which was pulled together because we received so many questions from parents in different countries, all getting answers, or even worse, not getting answers to their question about coronavirus. What does that mean for our boys? Is this a vulnerable group? And if so, how can we then protect them better? Is there any way to do so? We were also concerned, of course, about what is appearing online as news like what would help, could help, what medication you should take or take extra, and all that together made that we felt that we could, with the sources of information we have, provide you with some extra information so you can go back to your groups and discuss. I think the coronavirus is a threat to all of us. And first of all, I think we should realize how much the families in Italy already have suffered. And now with the lockdown in Spain, that is also a very serious situation. However, we see in other countries that we are more or less following the same path. So it's not that we really feel that it's only a few countries. It's really on our doorstep for all of us. So okay, I didn't do this. So what I really would like to state is that we have to share as much information as possible. But on the other hand, don't panic, as being quiet and being able to think properly is the most important thing we can do for our children. Just common sense, think about what we can do and not kind of run after all kind of fake news. So first of all, Suzanne will tell you a little bit about what we know about the COVID-19. Suzanne?
Yes, that's right. I think it's better to give indeed some kind of general information before we dive into the more specific information. So most of you might already know this information, but just a broad overview about the COVID or the novel coronavirus. So what we know is that it's a respiratory virus that can be spread by the little droplets or aerosols that you have when you're coughing or sneezing. But it's also that this virus can survive for hours on hard surfaces, so you actually don't have to see the person who is symptomatic and spreading. And especially the older population above 60 years and the vulnerable population are at risk. And this Wednesday, the World Health Organization declared the outbreak to be a pandemic, meaning that this disease affects the whole world. So if you'd like to know more about this whole virus in terms of how it started and what the big flu pandemic of 1918 has taught us when it comes to how to suppress further dissemination of this virus, I really recommend the Stanford webinar, Coronavirus for Non-Virologists, and I've attached the link in the slide if you'd like to know more. So I would like to give the mic back to Elizabeth, who will explain more about the coronavirus in relation to the Duchenne and Becker muscular dystrophy.
Yeah, well, we are in a kind of complicated situation, which we also saw in the preparation of this webinar. As most clinicians say, well, we love to think with you, but we are not a corona expert. So there are no experts who are an expert on DMD and on corona or on the combination, as we have not seen it yet in Duchenne boys. And also, even from the Chinese groups, Nicoletta has reached out to them. We haven't heard about any Duchenne boy with corona, or man, or I must say, could be girl as well. So everything where I say man or boy, you should read or listen like girl as well. So we haven't heard anything, so we don't know. There's no experience, there are no models. We can't say if they have a worse trajectory or not. We just don't know. So that is difficult to start with. However, in the context of what we do know, or what is known about the virus and what is known about DMD in general, the clinicians were willing to give us their thoughts, like to respond like, what is wise, what would you do? So just to make sure that you won't see this as a written in stone or like the guideline for corona and Duchenne, it is just based on what we know. It's very clear that in different countries, the situation is so different that the rules won't never apply to everybody. It's really different if you're in a country with a shutdown, or that you're in a country where only like 2 or 3 people are affected. So keep in mind, there's always the national rules, which are very important to follow in your country. But on top of that, we pick the brains of people who know a lot about Duchenne muscular dystrophy to help us kind of being the parent we want to be for our children and do what they really need. So with that, we can go to the next slide. So that's the questions and answers to the clinicians. We have asked 4 clinicians to respond on our questions. 2 of them offer to be in this webinar now. I see Professor Mercuri is online. Professor Goemans is on call in her hospital today, so she will call in as soon as she's available. And we already have some answers in writing from her. We have received them and already put them in the slide. So if she would not be able to dial in or dial in later, at least we have her comments. So the first slide, the first questions are kind of, what can we do best for our boys and men? Again, it could be girls. We cluster them around themes, these 7 themes, like what are the best ways of minimizing chance of infections and so on. And then for every subject, there are some sub-questions, and we ask them as well. So knowing that Professor Mercuri is there, thank you so much. Suzanne will unmute you, and probably we could already go to the first question.
Hi, Elizabeth. Hi.
Hi. So the first question, and that's the question we see over and over, is, should I take my son from school?
Well, I think this really depends on what's going on in the individual countries. In Italy, the schools have been closed for weeks, and we believe is a very good thing, and it was a very sensible thing to do, considering how the virus was spreading. In general terms, there is a problem with children because children are luckily not often affected by this virus. The numbers go from 1 to 3%. Only fewer studies are reporting more than 1 to 3%. And also they can be paucisymptomatic. They do not always develop all the signs that are more often seen in adults. Because of this, many children can be contagious because they are carrying the virus with few symptoms, and some of them even without symptoms, and therefore the risk of being infected at school is relatively high. So in the countries where the virus is still not present, or where there are very few isolated cases, this may not be an indication, but for all the other countries where there are already a few cases around, not going to school may be a good option.
Thank you so much.
This, of course,
sorry.
This, of course, is tailored to the country, to the individual. You know, it's not. We had a lot of discussions in the last week with the Italian Parent Project, and who have been involved, all the clinicians, in discussions about steroids and schools and so on. Again, this will apply to all the other questions and answers. There is no general rule that can be applied. Every time these have been really tailored to the individuals and to the individual countries. But in general terms, schools can be a problem in the countries where the virus is around.
Thank you so much. And then is the next question was is being on a plane. Sorry for the slides. I think Suzanne and I are together moving the slides at the moment. Is being on a plane a high risk to catch the virus?
Well, I think we all agree that traveling for the time being is not a good option, irrespective of the time on the flights. There is the time in the airports. There is the time together with many people in a queue in the airport, and the air in the flights is supposed to be filtered, but still you are sitting very close to other people, and the possibility of getting an infection is much higher. So in general terms, this is not time for holidays or unless something is really strictly necessary. Right.
I would like to ask the people who are now in the call who have their cameras on to switch it off, as that will be a load to the system. Thank you so much. Can we check also if Professor Goemans is already online or not? No, I'm afraid she's still seeing patients. Okay, then we can go to the next question, and that is how to follow instructions if resources are really getting very limited. I think a lot of people there meant like when we don't have alcohol to wash our hands, but there are some answers there as well. Can you tell us a little bit more? Thank you so much, Professor Makuri.
Well, soap and water are very important because very often people rely on commercially available liquids which do not contain the appropriate level of alcohol, which should be quite high. So in general terms, cleaning hands mostly, but also surfaces and handles, everything which can be touched is a general rule that can be applied by everyone, even when, you know, soap and water do not cost much. So even when there are no resources, washing hands and washing whatever is likely to be touched is very important. This is one of the best weapons we have to fight the infection.
Yes, thank you so much. And then we also already put on this slide that in general, as Professor Goemans said, in general, just hygiene is so very important for helpers, caregivers, and also, that's my favorite, make sure that you also clean surfaces and the handles and touch screens so that you try to avoid any contamination with the virus. So with that, we could go to the next slide, and that is could supplementing with vitamin C, vitamin D, or probiotics help? Anyway, people are asking, what can I do? Everybody loves to do something, so that's the question.
Well, this is a general question that we are asked every year when there is a flu around, or when there is any sort of infection. There is no evidence that any of the vitamins will specifically, you know, in general terms, healthy food with vitamins and minerals and so on are always useful in general terms, but we cannot really say that that we have to take specifically these, and we will be much stronger against the flu or the coronavirus or any other virus. So there are some general rules again of common sense that children should eat fruit and vegetables and whatever brings some vitamins, and the vitamin C is useful, but it's not a medicine. It's not something that will strongly defend against the virus. So it's not that there is evidence that if we do it, we will be much more resistant.
Okay, thank you so much. And I think that's exactly the same what Professor Finder and Professor Groeman said about that hygiene is the most important, being healthy in general, but don't follow, as is stated here, all the nonsense advertisement online. Just stick to a normal healthy program and make sure you get all the normal vitamins and supplements, right? So, but then, of course, we get the next step. We hope nobody will be infected and it will stay like this. But what if the boys get infected? What do you think? It will take longer to them to be in good shape again? What are your thoughts about that?
Well, again, we do not believe that the steroids dose we give creates a large immunosuppressant action, so the general rule, we had a lot of discussion in Italy, and I was very glad to see that Professor Montoni and Professor Finder and Natalie all agreed that we should not stop steroid, so it's I think in practical terms, one has to be practical, that the very young children are very rarely affected. We are more concerned about the older boys, but it's also true that the older boys also hardly receive the full dose of steroids that we give when we start the treatment. By the time they are in their 20s or in their late teens, they all have a much lower dose. So this is an extra element that should encourage not to stop steroids.
Thank you so much. We see that meanwhile, Professor Montoni also joined. Could you unmute Professor Montoni, Suzanne? Hello, good afternoon. Oh, you're double muted now, so sorry. So good afternoon.
No.
Would you like to add something to the discussion which is already started by Professor Mercuri?
No, can you hear me?
Yes, we can. Yeah.
Can
Loud
you
and clear. Yeah.
Okay, no, good afternoon. I completely agree with Eugenia, and I think that clearly the reality is that there are risks for everything, and the risk benefit is what should dictate everything we do as in every aspect of our daily activity. So I think to stop the steroids will certainly be very detrimental, because there will be a lot of problem related. It's not possible to stop the steroid abruptly anyway, even if we wanted. And there are clear problem related to the suspension of steroid, including the fact that during an infection for several months, children, if the steroids are stopped, still are not able to fight infections properly, not because they are immunosuppressed, but because the adrenal gland is suppressed. So if children get unwell, even during the phase of stopping the steroid, they must receive steroid anyway. So that doesn't appear to be a very sensible approach. I think that it is true we use steroids as immunosuppressant in people with a number of immunological disorders. The dose that we use as immunosuppressant are higher than the one we use in children with steroids. And I think I'm not an immunologist, but I have been working with children with DMD now for probably at least 20 years with children on steroids. And I cannot think of a single occasion, neither in my country nor internationally, where there have been a particular condition that has been associated with a patient with Duchenne having severe immunosuppression. And therefore, I think on one hand, we have a severe and certain risk of stopping steroid abruptly. On the other, we have really very little information on the fact that people with DMD, even on chronic corticosteroid, are ever a significant risk of the common infection. You know, people don't get necessarily a very severe flu. We want to avoid flu, but there is, you know, people that do not have generalized disease and body shutdown as a result of flu, even if they do not get the vaccination. So let's use the knowledge we have and the common sense, and therefore, in short, Eugenio is right.
Okay. Thank you so much. Thank you so much. And then to go, there was one question. We kind of would also have loved your input, as you live in another country than the Italians and the Americans. What would you recommend in terms of school? Would you say, what would you recommend for the children in terms of going to school?
Are you asking Francesco?
Yes, I am. You already answered. Sorry, I'm not. I'm a bad moderator. Sorry.
Well, I think that to some extent the advice will be largely that depending on which country you are and what is the risk at the individual time point. I think again, I think we probably need to step back a little and think that in due course, probably the majority of the population will be exposed to the coronavirus in a way or the other. And it's not going to go away immediately. So I think that if you like, the issue, I suppose, is what is unhelpful is for people to develop the disease at the time there is a lot of pressure in the hospitals. That I think is the reality. Now, there will be difference in different countries based on what is the peak of the, if you like, of the pandemic. So I make an example. In the UK, probably this is a good time to go to hospital because it's 4 weeks before, or probably more, from the peak of the infection. So this is a time when there is capacity. These things may change. So I don't think that you get a univocal, I don't think that there is a wrong and right answer unless you take it into consideration the timeline of where you are with the spread of the infection. So I think in general, if children have additional comorbidities, and I make an example. If a child with Duchenne had asthma, if a child with Duchenne had, or a more if you like, more older teenager had cardiac disease, if there were, if there is a child with significant hypertension and any aspect that will increase the risk, then I would certainly advise, because that risk in that particular child will be above the average. At the moment, as of today, I don't think it makes a huge difference whether an individual child in the UK is taken to school, but at the same time, families know their particular child. They may know whether the particular child compared to if you like, other children are very significantly increased in risk. I think, as Eugenio mentioned, the probability that people with the DMD will develop a very severe disease is probably not very different from that of the general population. So a young child with DMD will have a very similar risk the respiratory function of a child of 8 with DMD on steroid is 100%. So that risk of that particular child will not be very different from that of a child with DMD without DMD. It will be different in older people or with comorbidities. Then I think the more you have additional risk, the more one has to take that into account. Of course, this advice may change if in 3 weeks' time there is no space at all in hospital. And therefore, even if a very small proportion of people with DMD may develop complication, well, you clearly want to access hospital. So probably this advice will change. But I don't think people need to consider that advice is necessarily contradictory. Advice may change based on where you are in the curve of the infection.
Thank you so much. Really, thank you. So then we go to the next question. I understood that Professor Mukuri has to leave in 10 minutes, right? Is that true? Yeah. And Professor Goemans just said that she has an emergency in her hospital, so she will join us or later or not. So the impact of steroids, maybe we should first ask the question then to Professor Mukuri.
Well, I think we have already discussed this, that we do know they produce an immune response, but is a mild immune response, especially in the older children who generally receive a lower dose compared to the younger ones. So this is not a particularly cause of concern.
Okay, so maybe it's a good idea then, unless Professor Muntoni wants to say something, to go to the next question. Oh,
nothing to add.
Okay. Then the question was, and I think it might also be mentioned already a little bit, do patients have a higher chance of catching the virus? I think we discussed a little bit about younger children, but maybe it's also good to see it a little bit more in the context of the little bit older boys or men. Who wants to answer first?
Well, I will do it first because I have to go in a few minutes. I mean, in a way, it is true that boys with Duchenne, especially in winter, do not get out or are probably not in crowded places as much as their peers. So in a way, in Italy, we are seeing how easy is for this virus to spread. In some regions it has been really scary how easily it has been spreading, and even if some precautions had been taken, or at least part of the precaution had been taken. So in a way, I think it's not a matter of if a Duchenne boy has a higher chance, but it's a matter of what is the chance that these children will be part of crowded places, will travel a lot, will go into pubs and bars and restaurants in the countries where these are open, or in places where they are in contact with many people. So for the time being, there has been no evidence from China or in Italy that Duchenne are that we had any child with disability, not only Duchenne. We have been monitoring a group of other disabilities as well, and there is no evidence whatsoever that neither children or teenagers are more affected with a disability or using a ventilator or with other things may be more affected than others. So I think it's more a matter, again, hygiene, avoiding crowded places, and so on. If these rules are respected, then the chances are not higher than the others, are actually lower than the others.
Thank you so much. Do you want to add something, Professor Muntoni?
So yeah, I think that again, I completely agree with Eugenia. The risk, I suppose, again, thinking about risk benefit, the risk for an individual with DMD will be probably that of coming to hospital. And I'm not suggesting don't come to hospital at all if there is any problem, but we are now turning into telephone consultation for the time being for not just for the Duchenne patient, but for condition for which waiting another 4 months or 3 months is not a disaster. And therefore, I think the issue may be that of considering, and not only the coming to hospital, but is also how people come to hospital. For example, in London, people may have to come via public transport and so on and so forth. That's probably, and many of the public transport are very, 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 very busy. They are still very, very busy. So I think that if there was a scheduled appointment for a child on chronic, in a stable phase of the disease, I think the parents usually know if there is a problem better than doctors and physiotherapists. So if things are going well or they're not very different, I would probably postpone an appointment to hospital and resort to telephone consultation. This may not be appropriate in the individual circumstances if there are critical appointments, if a child is being recently started on steroids, and they just again use your common sense. But I basically reduce the risk the one you can. Public transport, busy public transport probably is not a good idea. Visit to doctors if you are well is probably not a good idea either.
Okay, thank you so much. Thank you. And then a question I think might, if we listen to everything, might be even harder to answer is, are they at high risk or vulnerable people most likely to die? As you know, like in every country, you say these are the basic rules, and then we have the vulnerable people, and they should to them apply other rules. So I think that is what families are wondering. Do we consider our children? But I think you have answered that already more or less. Are they considered the more vulnerable people, like the elderly people who die at the moment?
Well, this is what is weird with this virus. We had a telephone call yesterday with our colleagues in Milan who had many more cases a few weeks before the rest of Italy. And they had just a survey, a pediatric survey, and it's very strange that unlike other infections, unlike other virus, unlike any other thing in the past where there was a lot of concern for children who were immunodepressed on chemotherapy, etc., etc. This virus doesn't seem to affect particularly children immunodepressed or other children who are normally identified as fragile and at much higher risk. Of course, if we're talking about older boys or young adolescents or young adults who have a very reduced respiratory capacity and a cardiac problem, of course, the level of risk may be different. But for otherwise, for the younger population, doesn't seem that this virus has any sort that doesn't seem to affect particularly fragile children, which is very peculiar and different from other viruses that we had around.
Thank you so much. Professor Muntoni, would you like to add something, or should we go to the next question? Can you unmute, Suzanne? Can you unmute Professor Muntoni?
He's not muted, so I think he agrees to going on to the next slide.
No.
Sorry, I lost the page where I was. No, I agree. I think that, again, the children, I think that the risk will be largely dependent on the respiratory function. And again, the good news now with corticosteroid is that the respiratory function remains much higher for much longer. Of course, in the late teens and so on, or if the respiratory function is significantly compromised, then yes, that individual will be a higher risk than somebody with a completely normal respiratory function. So I think the risk may be stratified based on how significant is the respiratory problem and if there is any heart problem. But for people in whom there is a good respiratory reserve and heart function is within the normal limit, the risk is probably not any different from that of the other children. And as we heard from Eugenia, this risk, for reason that we do not understand, is not zero, but compared to the, my age or people who are older, is significantly lower.
Thank you. So you better take good care of yourself because we need you.
Well,
sorry, I missed this one.
Okay, so sorry, I have to go. Thanks to everyone.
Thank you so much. Thank you so much. Thank you. Now then, so now you're all alone there, as Nathalie is still in the emergencies. So then there has been a lot of discussion also online on ACE inhibitors. As parents saw that the ACE receptor was involved and they thought, oh, maybe we could give ACE inhibitors as treatment. There were people posting this on websites. On the other hand, there were people thinking like, oh, maybe ACE inhibitors are not so good. So that really has been a topic over the last week amongst families and in social media, how to see the role of ACE inhibitors in this disease or in this virus infection. And you sent us this slide saying basically don't change anything, right? Could you explain a little bit about that?
Well, can you hear me? Because I just changed my connection. Can you hear me?
Yeah. Fine.
Okay, that's fine. So, well, I think this is quite interesting because it's not only politics that go forward with fake news, but also the health system. So all this started because there had been some scientific correspondence regarding the fact that there is an association of the coronavirus with the receptor that is used by ACE inhibitors. I think this is, is the danger of people picking and choosing what is the truth is that we'll say, well, that has been published as a letter, was just a suggestion. Actually, there was no experimental proof. Then it became quite clear that whoever wrote that letter does not have understanding of what is the biology of this receptor and actually had confused different type of receptors as simple as that. And therefore, the letter that was written by, this was, I think, the Italian Hypertension Society reflects what has been rebutted in the scientific literature, that sometime or somehow it doesn't get the same exposure as the original scary suggestion, that there is no evidence, not only no evidence because at the moment it just makes no sense what the suggestion that there could be if like an interaction between these two. And therefore, coming back to my point of risk-benefit, you do not stop something that we know is beneficial for people in BMD for the theoretical, but also, as all recent suggestions indicate, even completely wrong evidence that there might be a negative interaction. So I think clearly, again, if there was, none of us has shares in company that sell ACE inhibitors. So the moment that there would be a concern, you will hear from us for sure. But until that moment, the scientific advice and the evidence suggest don't be worried about that at all.
Thank you. This really will help the community so much. You can't believe this. So thank you so much. And then the next question was about, should I get a cuff assist even if he doesn't need it? I don't know exactly what people mean with doesn't need it, but Jonathan Kinder answered it, but I think you can say something similar or have an opinion on this.
Well, I think that I think that unfortunately, I think I agree with what Professor Finder indicates. Unfortunately, if one is going to get a severe problem, the cough assist will not help. I think this virus gives rise to a particular type of pneumonia that is called interstitial pneumonia. And that is a very different type of pneumonia from other types of pneumonia where fluid accumulates and where poor cough may not help. So in actual fact, I think not only unfortunately for this particular subtype of pneumonia, cough assist, these are luckily not particularly common type of pneumonia, but these are not the type of condition, typically they will be associated with a very dry cough and you still get a very severe pneumonia because the pathogenesis is completely different. So I think that the cough assist may help if people get some superimposed additional bacteria pneumonia and so on and so forth. But I think this will be, again, for the discussion we were saying before, in risk benefit, the probability this will happen is remote. It's not zero, but it is remote. And I tell you, if somebody is at the stage where this will be required, I think that will be the stage you really want to be in hospital. It's not having trying to learn how to use a cough assist that probably will not solve 99% of the problem during that particular infection. So I think for this particular, cough assist is very helpful for other things, but unfortunately, I don't think will really make a big difference for this.
Thank you so much. Thank you. Sorry that we keep asking you. There are only a few more questions, I hope. So, and that is, are patients on invasive ventilation less likely to contract the virus? So the pulmonologist of the Leuven University has responded to that. We see there's a little discrepancy in the answers about the filters, as it's not here, but I think somewhere else Professor Finder says like the filters will be good enough to hold the droplets, where the pulmonologist more looks at the size of the virus versus the bacteria and says bacteria filters on non-invasive ventilators are less efficient for viruses, as viruses are much smaller. So that is, I think, a question a lot of people are thinking at home. At least let's speak for myself. We are thinking about that, like, do these filters help, yes or no? And what do you think? Would it make a difference?
I prefer to say that I do not know, and I prefer not to stick my neck when I don't know. I didn't have enough time to search into this. I suppose the similar principle as everything still applies. A virus still needs to get to that particular filter. And I suppose the general, clearly an individual with more advanced age and disease progression who is on invasive ventilation will need to be considered an individual at risk, and therefore both isolation procedure whenever appropriate and hygiene procedure to avoid that filter to get any virus would be what I know I can do, and I would certainly do it. I think I would need to check. I'm not knowledgeable enough regarding the virus particle, the filter ability to avoid transmission.
I think that it was the same for Professor Goemans. That's why she asked her pulmonologist, I think. Yeah. Thank you so much. Then that is the effect. And I think that is something you already have spoken about already. What is the effect on hospitals and hospital visits? Is there anything you wanted to add what you said before on this? In fact, basically people say here, well, if you don't have to go, don't go. But it's that. But you say, like in the UK, you're earlier in the curve, so that might be different.
Well, I think that we are early in the curve. At the same time, we need to these are the things we can do, and in a way, reducing the risk reducing the unnecessary risk still appear to be sensible. Coming to hospital probably has, because of the issue that I described before, a higher risk than that particular child going to school. On the whole, the advice is that we are just implementing as from Friday. So this is, Friday, at least in my hospital, this may not be the same in every hospital, is if it is a scheduled visit, the child is well, the child is is well known to the family, to the team, and there is no new finding, touch base by telephone to confirm whether a physical visit is necessary. I think we can, families know these children. If a family or if mom or dad are concerned about that particular child, that there is a new finding, then risk benefit will suggest bring him to hospital. But at the same time, if the child is completely well, we would do well with a telephone consultation as we speak. And this is the advice we've been given on Friday, yesterday. And therefore, from next week, that is what we will do. We will still see all new patients, and we will still see all patients in whom there is I make an example. Say that I know that a particular child with Duchenne has high blood pressure and needs to be checked and needs perhaps dose adjustment, then I think I would definitely like to see the child. The child who has been well, who is on the whole stable for the last 3 years or whatever, I think the child probably will touch base with the family, but ask them not to come.
All right. Thank you. And then, are there any additional medication we should take? Do you see any reason for that?
No, I think that I like the suggestion of Professor Finder, but this is a general one, and I think that it is fundamental that families know about the fragility of people with DMD in case they get unwell, and to know how to deal with the stress dose of steroids. That's an important point. So I think basically for individual with DMD is only to have enough steroids and ensure that there is a stress dose of steroids at home. But apart from that, again, people with DMD, you will know at least in the early medium stage of the condition, may be different in the in older individuals who are fully ventilated and so on and so forth. But the great majority of people with DMD, apart from the usual medication, is not that they need anything in addition to that. So be certain that there is enough for in case one of the parents had to be in lockdown and so on. And having said that, again, it may be possible to arrange courier administration or delivery of drugs, and that is also one thing we are exploring with our pharmacy in case individual families had difficulties to come and collect drugs. But common sense would suggest get some cover for the steroids in case you're not able to come every week to collect it.
Okay, thank you. So now all the responsibilities are on you. This is about. So we received many questions about vaccines, like the whooping cough vaccine, and we also had questions about the pneumovax, the vaccination against the pneumococcal virus, and sorry, not virus, the pneumovax vaccination. Sorry. And we saw in a lot of publications, like the fragile people, the vulnerable people, they should make sure they have all these vaccinations. We said to the families, well, it's important to have them in general, always, it's in the standards of care. But now they ask, is there an extra reason to go for these vaccinations? in the light of the corona virus?
Well, I suppose the theoretical risk is to get both of them at the same time. That would be undesirable. I think that would be the only reason. It's a bit like the flu. There is no mention here about the flu, but of course, flu is avoidable. There are the vaccination, and ideally, you would not like to have the flu and the coronavirus at the same time. So I think that the flu is now better understood, although occasionally some families still are not completely convinced that it's useful. And there are the standard of care for the, I think whooping cough, normally, at least in most countries, that would have been dealt with already. Pneumococcal is not mandatory, if you like, but I think it is recommended in this group of people. I think that the point that unfortunately will still take several weeks before a full cover is an important one, but there is no particular reason why one would not do it now. There is is not going to get the vaccine. You can look at it from the perspective to get the vaccination today, even in the unfortunate event somebody will get the coronavirus in 2 weeks' time or 3 weeks' time, should not put that particular child at higher risk anyway. So I see no reason why not to do it, basically.
Okay, thank you. So this is then the World Health Organization. Apparently, the Duchenne community is not the only community asking this question, like, do you need this vaccination or not? And it's stating the same as we discussed before. Although the vaccines are not effective against this virus, still vaccination against respiratory illness is highly recommended, just to protect your health. So now we come to the discussion. I have to discuss a second with Suzanne. We have some questions online, but most questions I think are answered already. I guess Suzanne has gone while we were talking through the slides and through the questions. And are there things you feel we still should ask and are not answered yet, Suzanne?
Yes, I see an interesting question from Gary, and he says that what about siblings that when they do not have Duchenne, should they stay at home as well?
How would you answer this one?
And I suppose you ask.
I'm very grateful to. I should have done like Eugenia. I mean, in a way, the question. I'm not entirely sure what the question is. So, is the question, what is the risk for? I think the fundamental point is the risk for children is in very, 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 very small. It's not zero, but it's very, very, very small. So, if the question, I mean, paradoxically, the risk may be more for the grandmother or the grandfather in that family, and it is how to manage that risk. So I think that I don't think you can lock down at this point in time a family, but it may, if you live in a country where the peak of the exposure suggests that, for example, children should not go to school, and then you have, then I think you should do that. If your child does not have a particular risk, and the advice at the moment is not to keep them out of school, I don't think there is a particular reason why you should not do that. I think this advice may change with the higher level of diffusion and so on and so forth. But I'm not entirely sure to have a siblings change fundamentally the particular advice for the particular child.
Oh, sorry. No, sorry.
No, carry on.
That families felt, as we got these questions as well, like, can my, let's say, healthy, whatever is healthy child, but my non-Duchenne child bring in the virus in our home? That is kind of how I think this question was put, like, what is the risk? On the other hand, I know, like in this country, they say kids better go to school than stay with their grandparents because they might infect their grandparents who might have a severe cause of the disease. So that is, I think there's a lot of discussions about that more in general, if it's wise to have children being always a grandparents or at school, and for whom is the highest risk then. Yeah. So
yeah, I agree, and I agree with you. Yeah.
So I think with this, we will close these discussions. Thank you so much also that you could stay till the end. We are really grateful for that. Thank you so much on behalf of really all of us. And we will make a report and send it to you so you can see it and share that with our members and also the families in all the different countries and translate it. So thank you so much. We will discuss a little bit with the families, the wrap up, and also about what we will do next. But thank you for your time. I think you don't have to feel guilty to leave us now as well. Thank you so much. Thank you again.
It's okay. Have a nice weekend. Thank you.
Thank you. Thank you. So for the rest, can you please hang in for another second? Oh no, 5 minutes, because we will have a few things to discuss with you as well. In fact, I think we all thought over these last days, what can we do as patient organizations? What can be our role? And I think we summed up a few things, and maybe you have more, but avoid fake news in your community. I think that is a very relevant one. I think share this webinar and report with your families and clinicians. We will make sure that this is online available, that we will have a report. We will really encourage you to spread the best information you can get, but meanwhile, respect local authorities and guidelines. As we know, for example, from the groups in Spain and Italy, it's totally different than from the people who live in other countries. So respect the local authorities and the rules. Follow up the WDO webinar on more specific questions. So we will have a follow-up webinar next week. We will tell you more about that because the next question is, of course, what can we do? What can WDO do for DMD and BMD patient organization? What can we do to help? We hope that this webinar helps. We hope that recording of this making it available for dissemination will help. We will again do the report and the translation. We also will have a WDO feed, a live feed, and a weekly follow-up report webinar to update the community. And we can support everyone we can. But we also would like to hear, like some groups already have been doing things in their country. One being, is Ryan still online, or is it, yeah, Ryan's here. So Ryan, can you unmute Ryan, maybe Suzanne, and just maybe you can tell about a webinar you are organizing next week and what you are doing in the US? Ryan of PPMD, are you there?
Yeah, I'm here. Can you hear me?
Yes.
Yes, thank you. We are looking to schedule a webinar. We've been in touch with our Certified Duchenne Care Center directors. We've been in touch with the Center for Disease Control, and this webinar has actually been very helpful to sort of give us additional questions to pose to experts. And this is going to be really a day-by-day, week-by-week thing where I believe we're going to have to put on these webinars and continue to convene the community. One of the other discussions that has come up, of course, is how this is going to be impacting clinical trials potentially. So, you know, these are real issues that we all have to face and come up with solutions around. So PPMD will put out some information on our site, and we'll be sure to connect with everyone on the line and share those resources.
Thank you so much. Thank you so much. And we also know that, like in some countries like Italy and Spain, and also we did in the Netherlands, we already sent newsletters to families, but we also discussed with our clinicians like what would be wise to say, so we all speak with the same tongue, as we say, because nothing is so confusing for families as hearing different opinions. Yes. So then I think we're all together in this, so we really have to help each other and make sure we're strong together. So the next, now I really would like to give the floor to Nicoletta. Nicoletta, is your mic open?
Yeah, I think so. Can you hear me?
Yes.
Okay, so hello everybody, and we were thinking about, providing to you medical information and specific clinical information, and we hope that we got this goal. But beside this important point for our community, we also have to think about our community in this really complicated moment, because we all know that everyone is absolutely worried about the situation, but we must be strong, and we must be united, and we are really a great community, so we can really show it, and we can really live in the best way this complicated time of our life everywhere. So in order to to be together, even if we are not together in the same place, we were thinking about a really simple social campaign, just to be in contact with everyone. And we created this hashtag that is Home for Duchenne and Home for Becker, because we know that staying at home in some countries like Italy is absolutely obliged, and also in Spain, but maybe this will be the same in other countries. But for our boys, staying at home is extremely important. So the objectives of this campaign is to involve the civil society on how best practice like staying at home and respecting the other ones is important for everyone, but is absolutely fundamental for people with rare diseases, serious diseases like Duchenne and Becker. And we also want to create a stronger community during this difficult moment. So we are all in together, and we can connect, we can be connected online in this way. So what we ask you to do is to share this information with your families, and every family can share a photo of them at home with the hashtag Home for Duchenne or Home for Becker, and every photograph will be posted on our social media, and we will also create a final video. So this is mainly the campaign that we will start soon, from tomorrow. So as soon as you have photos, you can send it to me and Suzanne, and we will post it or repost it from your pages. So I think that, Elizabeth, maybe we have finished for today. And as you have seen, we will have a webinar again next week in order to be in contact. And from our side, we just only wanted to tell you that we are here, and that we will survive this really complicated time, and because we are really strong, and we are really a powerful community. So please contact us, and we are always here, always connected.